So, New South Wales, what's working? And I'll just mention briefly about Mid-North Coast, but Michelle's got a bit more to say. So we've had new contracts in the Sydney, Hunter, New England and Mid-North Coast and the Illawarra, and they're the ones that are actually working. Having the HAP-Light system, I think, has been fantastic for mostly everybody. Technically, it can be a little bit difficult at times, but being actually able to have first-hand that knowledge and the pre-arrival medical examinations, I think it's really powerful for us to be able to get that, and certainly helps in regards to our clinical planning. In Sydney, we've been able to set up a bit of a service agreement with Enable, which is our massive New South Wales health equipment supply people that have got a warehouse that's like about 5 football fields full, and they've just got every little bit of equipment. And so when people return equipment that they don't think should go out anymore, they pop it in a corner for us, and every now and then we go in and do a raid. So having wheelchairs and commode chairs and shower chairs and all those sort of things has just been fantastic. So that's totally under the radar. There's no contracts, there's no MOUs. It's just nurses doing what we do best, and that's wheeling and dealing and, you know, nagging people till they give us stuff so we go away. The other thing has been some of the issues around accessing and uploading to AIR, to the Australian Immunisation Register. We've had some discussion at a New South Wales Health point of view, talking to the Commonwealth about the Commonwealth's responsibility to be able to download that information that belongs to the Commonwealth. Because at the moment, you know, it's generated by the Department of Immigration offshore, and then people are flown to Australia and they get settled by DSS, the social services people, but the running of their everyday lives is actually DHS, which is the Department of Human Services. So there's got to be some way of getting that immunisation information to dump it straight into that person's Medicare record. It shouldn't be up to you and me and harried practice managers sitting in busy GP things to try and decipher that. You know, if they can take photos of us from space, you know, while we're doing the gardening, surely someone from an IT point of view can work out how to just transfer a little bit of information. All right, challenges. I have to say the HSP contract in the Illawarra and the South Coast region of New South Wales is a total train wreck. It's really been quite disastrous down there, and again, we've had to ask New South Wales Health at quite a senior level to intervene here, because local health districts are quite powerless in regards to taking on these large Commonwealth-funded contracts, so I can't say much more about that, but it's certainly had an impact on the patients down there and the nurses. Challenge is always about patients with disability and frail aged care. The NDIS, another train wreck. Oh my God, whoever designed that, really give yourself an uppercut. That's just really, it's probably the most poorly designed program I've ever seen in regards to denying people their basic rights and the things that they need to live some sort of life with dignity. The same with EIEC, which is the early intervention program for kids with disabilities under the age of 7. We've had kids now waiting 2 years on that program with no services. So guess what? Now they're over 7. Now they can go across to the NDIS and wait on their waiting list as well. The 28 days on arrival equipment loan that is part of the HSP contract, I think needs a major challenge. We've started talking about that DSS locally in New South Wales and asked for a contract variation, because most service providers can't get you something within 28 days. And what we don't want is people left on the floor because their wheelchair's been taken back because they have to keep the contract. And I think the other thing that's been difficult has been the uneven number of arrivals. You know, we've had absolutely nothing to do Christmas, January, early February. We just, I don't know how many cupboards we cleaned out and restocked and blah, blah, blah. And now, of course, we can't scratch ourselves because people are arriving. So I've had 180 people arrive this month into Sydney. So trying to roster and staff, you know, in that sort of environment is actually quite difficult. And I think that's us. Oh, yes, so the opportunities, as I said, Ministry of Health to play a much more strategic role in the overseeing of the New South Wales contract providers. And I think there's a really good case for discrete funding to manage refugees with disability, and that should be discrete funding that comes to all of our services. We know what to do, and that may be that you need a social worker, you need an OT, you might need an equipment pool, but there is, did I push something? No, here it comes again.
There's a button around here somewhere.
A button?
Yes.
Okay. Lights.
Those are the wrong ones.
I only wanted me to get off, but gee, that was pretty rude.